Today we're talking about psychotic miasm. Okay? Psychotic miasm is the most common miasm that we see. We see it every day, every day, every day. So, gonorrhea. Gonorrhea is a sexually transmitted disease. The infection often happens in secret, in an illicit liaison that is hidden, and every respectable person in society knows that this is something that is not to be distributed. Well, other people should not be informed of this. So no one tells other people except for in very private situations that they've had gonorrhea or they have gonorrhea. So it's considered disreputable, embarrassing, humiliating disease. It's not fatal. You can live with it your whole life. It will limit you, but you can live with it your whole life. So this is kind of the essence of the psychotic miasm, is represented by the disease, gonorrhea. All these factors. Hahnemann says in chronic diseases, psychosis means figwort disease. These excrescences usually first manifest themselves in the genitals and appear attended with a sort of gonorrhea. So he says the qualities of psychotic miasm are excess. This is this standard word that's used to describe psychotic miasm. Excess, escape, selfishness, distrustful, suspicious. Okay, thank you. Inconsistent, indulgence in sex. But really, since we've been studying with Rajan Sankaran, we have quite a different approach to psychotic miasm, and it really does fit more the image of the illness itself. So, the main points of psychotic miasm are, number one, hidden. Secrets and lies. A person in the psychotic miasm is living behind a facade. They often have a very bland, cheerful, kind of what they consider normal expression. And that miasm wants people to believe that that's who they are. It's extremely important to them what people think of them. It's the world of quiet desperation spoken about by the poets and philosophers. Constantine Herrick described the psychotic miasm, and he said, really appropriately, all morbid manifestations are excessive, but appear quietly. At the beginning of the disease, it is scarcely known. Scarcely known and appears quietly are statements that clearly reflect the psychotic miasm in its mental as well as its physical state. People in this miasm prefer to stay in the background, quietly, reserved, ordinary. Ordinary is an operative word. In this way, they can successfully hide a deep sense of inadequacy and weakness, not too much emotion or expression. There's a constant tension in them involved in maintaining this state, maintaining this ordinary appearance. And often, if you are in psychotic miasm, even the most mundane things like just walking through a crowd, walking down the street, going to the gym and exercising, negotiating in a store with a clerk, when there's other people around who can see you and look at you, is a very stressful, uncomfortable situation. The most ordinary events for a psychotic mind because they feel that everyone's looking at them, everyone's judging them. So these things can be actually quite traumatic. These are the patients who most likely are going to refuse to allow themselves to be videoed when you ask, because that's a real you know, kind of putting it down on tape.